Okay, let's dive into a bit of a medical mystery. It's one that's hidden inside one of the most successful surgeries out there. So what happens when a procedure that's supposed to end pain actually leaves some people with a whole new debilitating kind?
First things first, let's set the stage. A total hip replacement, or THA, is for millions of people with arthritis pretty much a modern miracle. I mean, the data's clear. Satisfaction rates are incredibly high. It gives people their mobility back, their lives back, and that's exactly why the exceptions are so darn puzzling.
But for a pretty significant group of patients, the story doesn't have that happy ending right away. The research shows that somewhere between 11 and 25% of cases run into this specific, painful complication. Think about that for a second. That's potentially 1 in every 4 patients left dealing with something they just didn't expect.
And that leads us right to the big question we're tackling in this explainer. Why, after this blockbuster surgery, are some people left with this nagging, life-altering pain and a limp? What's really going on under the surface that so often gets missed?
So, before we start playing detective, you might be wondering, how do we know all this? Well, the information we're talking about comes from a super rigorous scientific review. This chart you're seeing, it shows the whole process. Researchers started with a whopping 566 studies and basically filtered and sifted until they had the 32 most important papers on the topic. So what we're looking at is the absolute core of what the science tells us.
All right, let's start by identifying the culprit behind all this pain. And to do that, we need a quick, and I promise, simple anatomy lesson, using a really powerful analogy that'll make it all click.
The key players here are 2 muscles you've probably heard of, the gluteus medius and minimus. Together, they make up what's called the abductor mechanism. Their job is absolutely essential. They keep your hips stable and they let you walk without a limp. Think of them as the powerhouse muscles right on the side of your hip.
And what's great about this image is it shows us exactly where these muscles are and what can go wrong. See how those big abductor muscles cover the side of the hip? And right there, that highlighted spot, that's a tendon defect. It's a tear, right where the muscle is supposed to anchor to the bone. That's the source of all the trouble.
So how do we get our heads around this? Well, the researchers who first figured this out used a brilliant comparison. They called it a rotator cuff tear of the hip. And if you've ever known anyone with a shoulder injury, this makes instant sense. It's the exact same idea, a tear in the tendons that are supposed to stabilize and move a huge joint.
Okay, so if we know what the problem is, why is it so hard to find sometimes? Let's follow the diagnostic trail and see how doctors actually uncover this hidden injury.
Here's exactly why it's a hidden tear. Its symptoms can look a lot like other, more common problems. A doctor might first think a patient just has bursitis, an inflamed sac on the side of the hip, or maybe just some normal muscle weakness after a big surgery. The real problem, the structural tear, gets completely missed.
But a really sharp clinician knows the clues to look for. The pain is very specific, right on the side of the hip. There's a limp that just won't go away. It's tender if you press on that bony part of your hip. And then there's something called the Trendelenburg test. A patient stands on one leg, and if the other side of their pelvis drops, that's a classic sign that these abductor muscles just aren't firing correctly.
Now, to really confirm what they suspect, doctors need to look inside. Ultrasound can be useful, but honestly, its accuracy really depends on how skilled the person doing it is. The real gold standard here is an MRI. And thanks to these amazing metal subtraction techniques, an MRI can basically see past the metal hip implant and give a crystal clear picture of the muscles and tendons around it, finally revealing that tear.
Okay, diagnosis confirmed. What's next? Let's check out the different pathways to recovery, which can be anything from simple therapy all the way to some pretty complex surgery.
The approach is really logical. It's done in steps. First, doctors will always try the simple stuff: pain relief, anti-inflammatories, and physical therapy to beef up the surrounding muscles. If that doesn't work, or if it's a fresh, acute tear, the next step is a direct surgical repair. But for those older, chronic tears where the tissue is in bad shape, that's when you need the really complex reconstructions.
And this slide just shows how innovative those complex surgeries can be. I mean, for chronic cases, surgeons can use an Achilles tendon from a donor, that's an allograft, or they can even reroute a piece of a nearby healthy muscle to take over the job of the torn one. It's really incredible biological engineering.
So, after all of this tricky diagnosis and these advanced surgeries, what's the final verdict? Does this stuff actually work? Let's see what the evidence tells us.
The key number that really pops out from all the data is this one, about 75%. That's the success rate we're looking at here.
And what does that number mean in the real world? It means that about 3 out of every 4 patients who get the surgical repair report a huge improvement in both their pain and their ability to function. For someone who's been living with a limp and constant pain, that is absolutely life-changing.
So let's just quickly recap the main takeaways. 1. These abductor tears are a really important and often missed reason for pain after a hip replacement. 2. They tend to happen more in women and in older patients. 3. A good physical exam is the first step, but a special MRI is what really nails the diagnosis. And finally, and this is the most hopeful part, surgical repair works really well for most people, giving them great pain relief and better function.
And we'll end with this thought. The results we have are really promising, no doubt, especially for those direct repairs. But the review also points out that for those super complex reconstructions, the muscle transfers and the donor tendons, we have good short-term data, but we don't really know how they hold up long-term. So the final question is, how durable are these amazing repairs 10 or 20 years down the road? And that is where the science is headed next.